we are aware, based on our research and discussions with our colleagues across the province, we are aware that some municipalities have looked at options to regulate methadone clinics. One example is a concept of an interim control bylaw. This is all based on zoning, and the purpose of an interim control bylaw is a bylaw that a municipality can put in place for about a one-year period that would allow the municipality to halt the development or the opening of a particular type of land use. And the purpose for that is to give the municipality an opportunity to investigate the concerns that may be raised. So we know that municipalities have looked at interim control bylaws. I believe there's at least a couple of examples across Ontario where the bylaws were put in place, but it's my understanding that they've since been repealed. Some municipalities have also looked at the concept of developing a specific zoning class for a methadone clinic. Now, I believe the City of Kitchener's approach is very common in terms of the zoning designations. It's very common amongst other municipalities in that a methadone maintenance clinic is essentially a health clinic or a medical facility, and most zoning designations, particularly in large urban areas, that zoning designation would allow for a medical clinic to open up in a significant number of areas throughout a city. Some municipalities have talked about the concept of specifically identifying a methadone maintenance clinic as a specific type of use, so taking it out of the general health care or medical use and identifying the methadone clinic itself as a specific use, much like you might have a drive-through restaurant type of use. It's our position, first of all, that these types of putting these types of regulations in place has the ability of creating a gap between the municipality and the operators and the neighborhoods, and we think that it's better to take an approach where a more collaborative approach where we build some relationships, as we're going to talk about in a couple of moments. It's common knowledge that there is no provincial requirement for a clinic to provide a municipality with advance notice before they open. Now, typically, the zoning regulations still apply. So, for example, a methadone clinic, typically, again, here in Kitchener, like in most places in Ontario, is classified as a medical office or a health clinic. And so they just have to ensure that whatever area of the city that they open up in, they can do so according to the zoning designations, which again is fairly wide open in most large urban centers. Sorry, I want to make sure I had the right slide. Yes. So regardless of the fact that there's no provincial requirement for a municipality to be given advance notice, there certainly are benefits that are realized when we've got an opportunity to collaborate beforehand. And what we're saying there is that municipalities often have a good sense of what might happen in a neighborhood when a use is introduced that could be controversial. And our suggestion to these types of operators is rely on the municipal experience to help you find some locations that make sense, and so that we can plan ahead and try to mitigate some of the negative perceptions that can arise. And the approach that Gloria and I have tried to instill here in Kitchener is that we step back and look at the big picture. If a clinic opens in a municipality or plans to open in a municipality, that's a very clear need, or a very clear indication that there is a need for that service in the municipality. And let's face it, I mean, particularly in Ontario, but I'm sure it's the same all across Canada. Healthcare initiatives are hard to come by, and I really don't think the community should be turning their back on healthcare initiatives, regardless of its particular focus. So when you, again, to step back and look at the bigger picture, from a municipal perspective, I know that many municipalities have processes in place to support business ventures in a community, whether it's under your economic development office or community development office or wherever it is. If a new business wants to open up in a municipality, there are staff here in Kitchener, and I can tell you, in most of the major urban areas, that will work with the people to find suitable locations and provide whatever supports are in place to make sure that the location is going to be successful. And all we're saying is, take a step back and look at these types of healthcare clinics that can be controversial in the same light. We've got a lot of municipal experience in terms of knowing what the nature of neighborhoods are, and we think it's advantageous for clinic operators to rely on our expertise. We do feel that the bylaw enforcement office in any municipality, but I can only speak for the City of Kitchener, we definitely have a role to play in developing and sustaining healthy communities, which means a balance of as much of a balance as we can achieve for everyone involved. So that's the neighborhood, that's the operators of the clinic, and also importantly, and unfortunately, this is the clientele that have to visit methadone maintenance clinics often get overlooked. And as the supervisors and managers of staff, bylaw enforcement staff in the City of Kitchener, we don't want our officers out on the road creating stress for people, and in this case I'm talking about the clients, that are already in an extremely stressful situation by virtue of having to take this treatment. And so we don't want to be seen as adding to that stress. We want to be seen as playing a role in mitigating that stress. There's certain obvious benefits to taking a collaborative approach, focusing on education and awareness, as opposed to the typical enforcement method, which is just responding to the complaints when people call in. We want to be seen as proactive in the community and letting the community know that we will, that we're going to build a relationship with the maintenance clinic, so that we've got that personal touch. Everybody's cell phone numbers. If an issue arises, we can make those types of calls. It's not our approach to go banging on doors and issuing notices and orders on clinics for what are, in the bigger picture, relatively minor issues. Again, just from our experience, we have 2 standalone clinics in the City of Kitchener. Both clinics are owned and operated by the same organization. It's made it somewhat easier for us, given the fact that we really only have to deal with one owner or an operator, and Gloria's done a tremendous job of establishing a relationship with the operators in our clinic, or with the clinics here in Kitchener, to the point where any concerns that are raised are discussed by phone, and we're able to avoid the typical enforcement model of issuing notices and orders. With this type of approach, when we've had community meetings, we've been able to get the clinic operators, and I will say that they were apprehensive at first, but they've seen the benefit of coming to public meetings and sitting down with neighbors to raise awareness around the type of clientele, but also to give the neighbors a sense of some level of comfort that if a concern is raised, that they'll step in and take a look at it. And again, I guess I'm repeating myself here, but in terms of the monitoring, we believe that our officers' role is to educate and monitor as much as possible, as opposed to simply reacting to the complaints. Some of the proactive monitoring that we do is that because of at least the location of one clinic here in Kitchener, it's raised some parking concerns. And again, in the bigger picture, relatively minor issues, but still these minor issues are visible to the neighborhood. So we've been proactively out there monitoring these clinics and talking to people about the parking issues and showing them that there's visible, parking, or there's lots of parking provided on site so that they don't need to park in front of somebody's house. Again, little impact on the neighborhood from parking, but it's the visual impact and the perceptions that we're having problems with. And I should also indicate that when it comes to the parking piece of it, when we talk about educating, we're also talking about educating the clientele that uses the clinic as well to let them know that there are better places to park, or we've got bike stands, or there's places to to take their dog and stuff like that. Again, very small things, but these people are stressed enough, and they don't need an officer issuing them parking tickets. We found that they more appreciate the softer approach, which is letting them know that that there's available parking in certain areas, and just to to lighten the load on the neighborhood perceptions themselves.